Did you know your body sends surprising signals when you're deficient in vitamin B12? This video explores everything you need to know about vitamin B12 deficiency, from the most common symptoms and causes to risk groups, medications that can interfere with B12 levels, and the best forms of treatment. It also explains how to identify deficiency through lab tests and what to look for in the results. As a bonus, it offers simple habits to improve absorption and protect your health. Why is vitamin B12 so vital? Vitamin B12 is mainly found in animal-based foods like milk, eggs, red meat, seafood, and fish. For vegans who do not consume these products, supplementation is often necessary. However, even those who eat B12-rich foods may struggle with absorption, as this process requires gastric acid and intrinsic factor, both of which decrease naturally with age. This puts people over 65 at higher risk, with studies showing up to 20% may be deficient, underscoring the need for regular testing. Other risk factors: absorption can also be impaired by digestive surgeries like bariatric surgery, autoimmune diseases such as atrophic gastritis and pernicious anemia, pregnancy and breastfeeding, which increase the body's demand for B12. Certain medications like proton pump inhibitors, e.g. omeprazole, pantoprazole, and metformin, commonly used by diabetic symptoms of deficiency. Symptoms are varied and can be confusing, even for doctors. Key signs include memory problems that may progress to dementia, symptoms of anemia, extreme fatigue, shortness of breath, paleness, and trouble concentrating, tingling in the limbs due to nerve damage, demyelination, mood changes, depression, hair loss, dizziness, and difficulty walking, vision problems, such as increased risk of macular degeneration in older adults, weakened immune system, and increased vulnerability to infections. How to diagnose it? Early detection is essential. Tests include blood levels of vitamin B12, homocysteine and methylmalonic acid levels, evaluation of related nutrients like iron, folic acid, and vitamin B6. A complete blood count, CBC, may show enlarged red blood cells, an indicator of megaloblastic anemia caused by B12 deficiency. Treatment and prevention. Treatment typically involves oral supplements, but in severe cases, intramuscular injections may be required. Dosage should always follow medical advice. To enhance B12 absorption, avoid excessive alcohol consumption, refrain from extreme diets without guidance, maintain a balanced, nutrient-rich diet. Now that you understand the causes and symptoms of B12 deficiency, pay close attention to your health and diet. They may be affecting your B12 levels more than you realize.